Welcome everyone. This is Doug McCall from the International School Health Network. We're going to be starting this session today. Welcome everybody to this first of several sessions on school health promotion. Very pleased to be looking at the topic of school nursing, looking at the evidence and experience that support the greater investment in that part of school health promotion. We have three speakers with us today that I'll be introducing in a moment, and thanking them in advance of their session and their comments. Yvette and Carol, I'm in email dialogue with Erin. She's having trouble getting in, but she should be here shortly. So what I thought we would do is start with Yvette's presentation and then go to Carol and then come back to Erin when she's online. So if that's all right, if you could sort of get yourself ready for that. The session description is on the page. For those of you who have just joined us, you can ask questions and make comments either by typing in the chat box or by speaking in your microphone on your headset, or if you have a very good microphone in your computer. To enter a message in the chat box, you simply type into that white space in the lower left-hand corner and then press enter, and your message will be displayed for everybody to see in the space right above that. Please feel free to make a comment or to ask questions, or if there's a problem to communicate that way throughout the session. I'll be keeping an eye on it as we move forward. If you do have a microphone, a good microphone, then please click on the talk box, which is in the upper left-hand corner. When your mic is active, there's a little blue microphone that comes on, and so you'll be able to see that you're active. Please click on the talk button and make your comment or ask your question, and then once you've finished, please click on that immediately to turn your microphone off. That improves the data flow in the system and allows for other people to speak as well. If you want to check your audio input and output anytime during the session, you can do that by clicking on the little microphone at the very top, right beside the words audio and video. And if you click on that, you'll be able to go to a dialog box that checks your microphone. So we're looking forward to three presentations for today, and then for the last half hour or so to be looking at discussion about this important aspect of school health promotion. Yvette, I'm going to ask you to, I'm going to move the slides forward until we get to your slides, and then you could take us from here. Yvette, as many of you will know from Ontario, but across Canada and actually internationally, Yvette has worked in school health promotion for many years, and like some of us, we're semi-retired, and so Yvette continues to take an interest in this area of work as she's retired or semi-retired. So Yvette, very pleased to be welcoming you, and if you wanted to start your remarks, and then we'll go to Carol, and hopefully by then Erin will be online as well. So,
okay,
Yvette?
Doug. Yes, thank you. Welcome, everybody. Can you all hear me? I'm hoping I'm coming through. We did a sound check earlier.
Yeah, very good.
It's my pleasure to spend some time with you today to discuss what's happening at the national level, and to talk about what's happening in Canada. I'm assuming there are some people from outside the country, and so some of my slides will be giving a description of what public health nursing practice is like in Canada. Talking a little bit about what's been happening to move the discussion of school-based public health nursing to a national level, and share with you a few of the project findings from the Canadian Nurses Association, some of which have already been shared at other conferences, including the annual meeting of the Community Health Nurses of Canada, in a workshop at the Canadian Public Health Association, and then at a number of provincial meetings. So let's start off with what is a public health nurse. We think we know what they do, but as I discuss further, we'll see that we still have some challenges. But in Canada, a public health nurse is a registered nurse with her registered with her regulating body, which is at a provincial or territorial level. They have baccalaureate degrees in nursing. We have certification in community health nursing. In some of the American states, they have certification in public health nursing, and if you want to practice in public health nursing, you must be certified. Public health nursing combines knowledge from public health science, from primary health care, including determinants of health, nursing science, and social sciences. Public health nursing focuses on promoting, protecting, and preserving the health of populations. While the practice of public health is population focused, it can focus on subpopulations that have similar health concerns and characteristics. So we work with individuals and families because we know that a community's health is closely linked to the health of its members and is often reflected first in individual and family health experiences. And we know that healthy communities and systems support health and contribute to the health of individuals, families, groups, and communities. Public health nurses practice in diverse settings, including most of us are affiliated with a health authority or a public health department, as in Ontario, or a public health unit. They work in community health centers, schools, clinics, and nursing outposts. There are a number of foundational documents that describe the practice of public health nursing. We have national or Canadian Community Health Nursing Standards of Practice and a professional practice model. And the standards address health promotion, prevention, and health protection, health maintenance, restoration, palliation, and professional relationships, capacity building, access and equity, and professional responsibility and accountability. And most regulating bodies have similar standards addressing similar topics. We also have public health. I might add that the standards were first released in 2003. So we have had certification since 2006. The public health nursing discipline specific competencies were released in 2009, and they identify the knowledge, skills, and judgment and attributes that are required to practice safely and ethically within the core competencies of public health. And last but not least, we also have a document called Public Health and Community Health Nursing Practice in Canada. And that particular publication actually identifies a number of roles and activities and interventions for public health nursing. There were about 272,000 nurses working in Canada, registered nurses, and about 15% of registered nurses work in community health. But you can see that the majority, 60%, work in community health centers. We really don't have any current national statistics on the number of public health nurses. There are provinces that certainly keep track of that, but we don't really have a national picture. In 2007, in the Naylor report on how the country had handled the SARS outbreak, it was estimated that there were about 12,000 public health nurses in Canada, and that they made up about 33 to 50% of the public health workforce in Canada. There are a number of investments since the establishment of the Public Health Agency of Canada. There certainly have been significant investments in public health from about 2004 to 2012. And certainly that the funding through the Public Health Agency made possible those documents that I described earlier on. We have a Chief Public Health Officer. There are 15 applied public health research chairs in the country, and we also have national collaborating centers, 5 of them that are focused on determinants of health, health policy, methods and tools, Aboriginal health, and environmental health. So there have been significant investments in public health. The other thing that is happening is there is greater interest in reforming primary care with a greater emphasis on health promotion and reducing health inequities and promoting interprofessional practice. Certainly, CNA and other associations and governments are supporting the shift to community-based care and also strengthening collaboration between public health and primary care. And we're seeing similar changes in education, at least in Ontario, although I think many provinces and territories are really focusing on the whole student and on student well-being. So this is very timely and significant to our discussion on school-based public health nurses. Over the years, you know, I would say that from my discussions with colleagues and teachers, both in the public health and education sector, and with researchers in the last 15 years or so, we noticed that there is a great variation in the scope of practice of public health nurses across the country. High student-to-nurse ratios really dictate what public health nurses can do. So, for example, in Ontario, you might have public health nurses that have one school, and in some areas, maybe up to 25 schools. So it makes it, that is one of the reasons for the great variation in what public health nurses do, even within a particular jurisdiction. This has created confusion among educators and the public, and certainly it's not only Ontario that has found this, but we felt in Ontario that there was a need for a national strategy to get some clarity, and as a result, the Registered Nurses Association of Ontario and its affiliated group, the Community Health Nurses Initiatives Group, submitted a resolution to bring this concern at the national table. And there you have it before you, the resolution that was passed at the annual meeting in 2012 and further approved by the Board of Directors in the fall of 2012. They initiated a study that included this methodology, a review of published literature and gray literature. There were key informant interviews with Canadian experts, and then there was a separate review of international trends, but I am not going to be able to discuss that today. I'm going to review some of the findings from the published literature. There were about 84 articles that were found that were included in this particular review. The work was contracted by the CNA to independent consultants. As they reviewed the literature, these were the following themes. Public health nursing practice in general, not just in schools, but in general, is not well understood by the public, and in some cases, the governments, the provincial governments and federal governments. The role of the public health nurse in schools is unclear, and there's a great deal of variation. Schools are key settings for health promotion, and there's quite a bit of literature on that, and there are journals that are dedicated to looking at school health promotion, and several international associations that are dedicated to school-based health promotion. There's evidence, significant evidence that comprehensive school health can be effective. And the other theme that came out in the published literature is that public health nursing resources and time are often insufficient to address the needs of the schools. So that oftentimes schools are actually demanding or asking for more service or different services than what the public health units can actually provide. There's a fair amount of literature on the importance of successful relationship building. This is a concern that has been described in the literature and in other gray literature about the erosion of relationships between public health nurses and school communities. When a nurse is able, when you have a good relationship with the school, there seems to be a clear understanding of what the nurse can actually bring to the school, and it also facilitates the ability to establish collaborative relationships with not only the schools but the boards and other community agencies. And when a public health nurse has established a working relationship with school communities, they are better able to engage in school-wide health promotion and facilitation of community engagement. There is little health outcome evaluation taking place, and we may hear more about that from Erin. When the contractors interviewed 14 key informants from across Canada, again, similar themes came up. Again, there's very little research on the value of public health nursing and upstream approaches. There seem to be inconsistent interpretations of population health and public health within schools across the country. There are fairly complex systemic issues both in the education and health sectors that seem to be influencing how public health works in schools. Oftentimes, short-term deliverables are what's being emphasized, and we know that health promotion often takes considerably more time. And oftentimes there are competing priorities for funds, and oftentimes schools get underfunded or under-resourced. The key informants also found that there were inconsistency among and within the provinces and territories, so that was certainly consistent with what I had observed over many years. They confirmed that public health nurses are not working to full scope of practice. Interventions are often aimed at individual versus school or populations, so that public health nurses are often busy with immunization and STI testing and one-on-one counseling rather than the whole school population health promotion. There is a commitment to comprehensive school health. The key informants all talked about that, but it seemed to vary from province to province in terms of allocating staff to actually work with schools using a comprehensive school health approach. The researchers, the contractors, found that there were, in Canada, there seemed to be three sources of information for actually describing the work of nurses in schools. We know that NASN has been in place for a number of years, and they have national standards which guide their certification process. And describes the scope of practice, but certainly their practice functions more in a primary care model, given their healthcare system. L'Ordre des infirmières et infirmiers du Québec released standards of practice for nurses working in schools. That is guiding the practice of nurses there. And they were just released a couple of years ago. And then the Community Health Nurses Initiatives Group of the RNAO released last year in June of 2013 another way of describing the scope of practice. Within the contractors try to provide a visual of what public health nursing in schools might look like. And this might be a little difficult for you to see in terms of what's in actually those little balls going around the circle, but those represent the 20 public health nursing interventions that were described in the green book, the CPHA book called Public Health, Community Health Nursing in Canada, and are also in line with the Minnesota Public Health Intervention Wheel that has underpinned some research that has gone on in America. So it's another possibility for actually trying to describe the scope of practice for public health nurses. There were recommendations that came out of the national project through the CNA. At the organizational level, these were the following recommendations: that there needed to be an investment in a healthy school strategy, that developing and maintaining intersectoral relationships with boards of education and other organizations that work with children and youth is important, that public health needs to identify schools as a priority setting and needs to commit to new resources or redistribute existing resources. It's important to articulate the role of the nurse, public health nurse in schools, and to empower nurses to work to their full scope of practice. Research is critical to, again, developing the evidence base that will support the practice of public health nurses in schools. Certainly the public health nursing competency should underpin any job descriptions of public health nursing positions, and the leaders that were interviewed also indicated that we needed to advocate for nursing education with strong public health components that is taught by nurses. At the systems level, governments and policymakers at all levels need to shift their funding and or policy emphases to new school public health nursing models that should include schools as a priority setting, adequate public health nursing resources in schools, and strengthening collaboration between ministries. The report concluded that public health nurses have the potential to significantly influence the health and education outcomes of Canada's school-age population. They're well positioned to build effective structures and processes that support school communities to identify and respond to the needs of the populations they serve. So that's the end of my presentation, and you have my email address as well as Carol McDougall's, and should you want any information from the Canadian Nurses Association, Lisa Ashley is a senior nurse advisor who was overseeing this project. Thank you.
Thank you very much, Yvette. It was an excellent overview and helps to put the public health nursing in schools within the context of school health promotion. It was a very good beginning. Erin, I'm glad to see you arrived. Can you click on your talk button and see if we can hear you? Erin Mon. The upper left-hand corner. Okay, so Erin is in the middle of testing her microphone. So Carol, why don't we continue on with this presentation and then come back to Erin when she's finished testing her mic. So introduce Carol McDougall, who is Manager of Public Health in the Perth District Health Unit in Ontario, longtime advocate of school health promotion as well, and co-chair of the Healthy Schools Coalition in Ontario. Carol, do you want to take us through your remarks?
Yes, I just couldn't get to click the talk button. Welcome everybody. I'm delighted to be here today and share just a few of the developments that have happened specifically in Ontario. I will not go into great detail. Essentially, there is a policy paper that Yvette referred to that was drafted that people can access online, and there is an evidence paper that will give more details as well that I'll make available to Doug for sharing. In Ontario, we had nurses, public health nurses in schools up until approximately the mid-1990s. For the most part, there were changes in public health's focus and funding changes that caused many of them to be withdrawn from schools. So there's been significant amount of advocacy since that time, resolutions to various organizations, the Registered Nurses Association of Ontario, even the Ontario Public School Boards Association tried to get school public health nurses back. And we did have a working group in the province that drafted a school health guidance document, which documented the role of public health in a general sense with schools. But we did recognize that there needed to be some more specific information about what nurses as a discipline can contribute to school communities, specifically from public health sector. So in June of 2013, the Community Health Nurses Initiatives Group released a policy paper which is called Healthy Schools, Healthy Children, Maximizing the Contribution of Public Health Nursing in School Settings. Subsequent to that, it became apparent that that paper didn't actually provide the evidence base for why we were asking for a return of public health nurses to schools and a defined scope of practice for them. So we have the working group, the School Health Working Group has pulled together evidence paper that provides some substantiation for that. Basically, we see school-based public health nursing as settings-based health promotion. It is similar to Healthy Cities movement, healthy workplaces. Healthy schools are a setting that has, schools have unique challenges in terms of effective networking and relationship building and functioning. So we do perceive it as a specialized area of practice. We are very fortunate in Ontario that our Ontario Public Health Standards do articulate a role in comprehensive health promotion approaches with schools for public health practitioners. We are multidisciplinary in Ontario, so we have nutritionists, health promoters, health educators, various professionals that contribute to school health promotion. So this evidence paper focuses on the nursing contribution. As Yvette mentioned, we see it as the full continuum of work one-on-one with students and families, small group work with groups of students or classrooms, school-wide health promotion, and board-wide or community-wide health promotion.
Carol, your microphone is, for me at least, is quite soft. I can still hear you, but did you move away from your microphone, or did it?
Can you hear me
Yeah,
better
that is
now?
better. Thanks.
Oh, sorry about that. So in this paper, we did acknowledge the foundational documents that Yvette referred to that articulate public health nursing practice, and the RNAO best practice guidelines that inform school public health nursing practice, such as primary prevention of childhood obesity, enhancing healthy adolescent development, integrating smoking cessation into daily nursing practice, and client-centered care. We also gave 3 examples of other jurisdictions that are moving forward with advocacy for school nurses. Erin will probably talk about that, so I won't go into that, but the UK as well has a Royal College of Nursing UK position on school nursing, and Yvette already described the Quebec standards of practice for nurses in schools. We showed how there's at least 8 different journals that publish evidence on school nursing, so it certainly has a body of knowledge that is unique. We provided some environmental scans that have been done in Ontario, a region of Waterloo Public Health, and Simcoe Muskoka District Health Unit both did surveys in 2012 regarding school health programming. And the Simcoe report found that 29 of our 36 health units have adopted a Healthy Schools or equivalent model for their delivery of school health programs and services. And 28 of those 29 have public health nurses as one of the job titles using this process. What was very interesting was also looking at the grey literature. We were aware of colleagues in the province who had done some evaluations of their school health work, and my own health unit has a unique program with cost-shared funding for public health nurses in schools because it's a rural area, and the board wanted to have access to that service. And our findings showed that the greatest impact was in students' increased ability to deal with problems, increased hopefulness, reduced worrying, improved relationships at school and at home, and better decision-making about healthy living, as well as respectable improvements in marks, schoolwork, and attendance. And the Halton program, they have mental health liaison programs where nurses work with students, and they showed improved coping skills, improved problem-solving ability, improved mood, and improved thinking patterns. And 95% of the students receiving their service achieved all or some of the goals that were set with them. So there's also a region of Waterloo Public Health evaluation of their sexual health services for secondary school students. And Niagara Region Public Health has an evaluation, a client-centered care satisfaction report. So it's actually very interesting to look at the grey literature. The oh, sorry, I should have flipped to that slide. Sorry about that. But those reports can all be found online, I believe. Then we asked the Simcoe Muskoka District Health Unit Hub Library to do a literature search for us, and there were articles in these topic areas that were found. It wasn't an ultra stringent kind of lit review. It was just, the first kind of cut at it, but I'm sure if we had resources to dig deeper, we could find even more. But what I would like to do is just share for a couple of minutes some of the highlights of these topic areas. And I have not written all the citations for each of the bullets. They are available in the evidence paper because I do want to acknowledge all the authors who did all the hard work, but it would just too crowded on the slides. There is a lot of written about how the full scope of practice can contribute to or contributes to improving school attendance, high school completion, and identification and referral of students with mental health problems. And the interesting thing with this literature is that a lot of it is done in the United States, where the nurses in schools do a lot more clinical care than we do in Canada, because we have public health care system. So for medical conditions, for the most part, our students can access care. We're primarily focused on health promotion and sexual health services in schools, particularly in Ontario. Some of the literature you will see are studies, and some are just descriptions of the experience of school nurses and how they contribute in many areas. This 4-year case management project showed 84% improved in one or more areas. There were a number of articles about barriers to school nursing practice, and there are challenges. Certainly that would be another whole webinar. The preparation of nurses, ongoing education, staffing levels, how well they're integrated into schools, and Erin Mon was the co-author of this comparative review with guidance counselors, looking at how well guidance counselors have been integrated into school systems and how school nurses could use some of those strategies ourselves. And then the whole concept of marginalization, how school nursing, because we are so isolated in our work in schools, it's hard to get the advocacy moving forward. Bullying, there is a lot about the unique position of nurses to contribute not only one-on-one, but with peer groups, school-wide changes to school climate, district-wide bullying, strategies for whole school boards. There's documentation about suicide risk, peer victimization, how nurses are in a position to identify students at risk and intervene and promote healthy peer interactions. There is written work about our role in comprehensive school health and the need to develop our leadership skills for the facilitation role of healthy school committees and school-wide health promotion. And in some cases,
again, you're fading out. Can you make sure your microphone, you're facing your microphone? Thanks.
Yeah, sorry, it kind of moves as I move my head. Sorry. The Yvette described how anyway, we basically sometimes have both areas of problems: practitioners, nurses who are working in one-on-one and need to learn the health promotion skills, or nurses working in health promotion who need to learn the one-on-one in order to be able to operate within the full scope of practice. So there's both challenges there. A lot, and Erin will talk about this probably, there's a lot of need for ongoing evaluation, and there are no randomized controlled trials of schools with nurses and without nurses. There is research showing positive impacts on immunization rates, and impacts in being able to involve youth in focus groups to enhance program planning and evaluation, but there's still a lot of research needed. Family violence, again, it's the idea of being in an optimal position to pick up students who are at risk of violence and getting them the help they need. Studies on immunization regarding HPV, the human papillomavirus vaccine, and the positive impact when there's a PHN assigned to the school. Better trust in public health programs, ability to send reminder calls. Mental health is also a strong area where school nurses can contribute in terms of identifying one-on-one students who are at risk. They get school staff and principals, refer students to the nurse, as well as educating the community at large, reducing stigma, working with youth to reduce stigma, and advocating for services in the community. Being involved with youth on mental health promotion, illness prevention, early intervention, work with families, school staff, and we have a significant role with support groups for students. A lot of social skills and coping skills, stress management, areas like that. Nutrition, we can support the work of our nutritionists and dietitians in, mobilizing youth to work on healthy food environments. Parents are very satisfied
Carol,
when
we need to be
I know,
cautious
I'm
of
almost
time.
done.
Okay,
Yeah.
thanks.
And parent support and school-based health centers, a lot of contributions there, particularly with sexual health. Self-injury, again, the role in identification and referral, and sexual health, a lot in that area in terms of sexual health services. So as a conclusion, ongoing discussions we'll be having with our school health committee and our school health managers and the board of the Community Health Nurses Initiatives Group. We'll be making a few edits to our recommendations in our policy paper. We're hoping to meet with the Registered Nurses Association of Ontario to see if there is an interest in working on some advocacy in this area. And we're looking forward to continuing our involvement with Doug and the International School Health Network and the National Association of School Nurses with Erin. And that's it.
Great, thank you, Carol. Erin, do you want to click on your talk button and just make sure we can hear you?
Absolutely. Hello, everyone.
Yep, that works
Can you
fine.
hear me
You're
okay?
good. Yeah, I'll just go back to the first slide and, oops, I went to the wrong one. And you can, if you see the arrow, the forward and advance arrows at the top of the page, that's great.
Okay,
Erin is Research Director for the National Association of School Nurses, and I'm smiling as I say this, Erin. Welcome to the session, because that was a bit of a travail to get you there. But
Yes, I'm happy to be here. We tested this a few days ago, and it worked fine, but today, but I'm so happy. It was actually really good to hear Carol's presentation, sadly, I didn't get in for Yvette's, but I think it fits kind of well at the end too, even though we were originally thinking the beginning. What I'm going to share is some kind of continuing on what Carol was saying, some of the obstacles that we have regarding research, some of the research briefly that we use, although Carol mentioned many, so I can go with that pretty quick. And then finally, I wanted to touch on some research we're doing that is actually looking at the role of the school nurse around the world to see how we can learn from each other and possibly do some collaboration. So it has kind of already been mentioned, but I just wanted to bring it up again. One of the biggest obstacles that we have in school nursing excuse me, is actually obstacles to evidence. There is evidence out there related to school nursing, and Carol did a great job reviewing that. But as she mentioned, it is limited, and the rigorous studies that they really want us to do are their RCTs, or random controlled trials, and there really aren't any out there for school nursing. Part of it is because of the fact of the nature of the work in which we do doesn't lend itself well to that, but also because in order to do something like that, it costs a lot of money and it's a very intervention type study. So that is definitely one of the barriers. The other barriers, as mentioned, is that oftentimes school nursing research is kind of buried in with other topics. It might be under school health services or clinics or a specific topic, for example, bullying or immunizations, and you have to really dig in and then see the intervention is including a school nurse. This makes it hard sometimes when trying to do a review to gather all the information, because the author might not have thought to put school nursing in as one of the key words, and it makes it difficult. And so we have to kind of be a little savvy as we do reviews of the literature to find the information that really is about school nursing. And then the other issue that's an obstacle has been mentioned by Carol as well, is the strength of the data. Not just RCTs, although that's a big part of it, is that many of the studies that are out there do not have a very large sample. Oftentimes they say right out that it's a pilot study, so they're not trying to mask anything, but it just makes it so it's hard to say that that can be necessarily generalized to other groups, and what we consider the rigor of the study is not as strong as it could be. But we're working on that, and actually just to interject here, before I go and talk about some of the research that we use here at NASN, is I wanted to let people know that we recognize the need for stronger and more national-sized data. And so one of the initiatives that we're doing here at the National Association of School Nurses is actually developing a uniform minimal data set. What that means is that school nurses across the United States would collect certain data points the same exact way, so that it could be compiled together, so that we would have quite a robust database that would be national, and then we actually could then do some additional analysis there and answer some of the big questions that we have, questions about what is the best ratio, or what is the best workload for a school nurse, what is the best model of school nursing, because all of these are questions as well that we don't have the kind of research we would like on. That is a process we've begun this year, where it's voluntary. We're collecting the first few data points this year. In addition to that, though, we do have every 2 years, and so it'll be coming up in 2015, a school nurse survey. It used to be just a membership survey, but we found that we really want to know what's going on with school nursing if you're a member of NASN or not. And so similar to the survey that Carol mentioned, we do one here in the United States that asks questions about what is going on, what type of activities school nurses are doing, what is the model of care. Is it one RN in a school? Is it an RN covering multiple schools? Do they have aides or others that are working with them? As well as the activities and where they put a lot of their focus. So again, that will be coming up early in 2015. So what we do have now, and what I just want to briefly go over, is some of the research that we use here at NASN. And we use others for sure. I just picked out a few, and I actually picked out just a few of the references as well. I tried to get the most current, to be honest. But we kind of focus it in different areas depending on who we're speaking to. Of course, educators and the decision makers are sometimes and oftentimes our biggest decision makers. So research regarding cost effectiveness. This is research that was done, just published this year, that a health economist from the Centers for Disease Control and Prevention used data from Massachusetts. And yes, as Carol mentioned, Massachusetts has done some great research for school nursing. But they used the data that Massachusetts collects, and the analysis showed that for every dollar spent on having a school nurse in the school, $2.20 was saved. And they estimate that that's actually a very conservative estimate because it didn't include any health promotion teaching. It didn't include anything about hospitalizations or ER visits or anything like that. It just really focused on mostly nursing or medical treatment and then parent productivity. So that encourages us that there's even more of a return on investment that we'd like further research done on. Another focus we do is where is school nurse uniquely able to impact outcomes? This is because as working with teams, it's sometimes hard to say, well, it's the school nurse that did it. We recently completed a study this year that actually identified 6 school nurse indicators that we'd like to really focus on and do additional research on. Absenteeism and seat time are 2 of those. And there is some good literature out there that does show, as Carol mentioned. Also, vision wasn't identified as our top 6, but it's definitely one, too, that we see that school nurses impact. This study in particular was, again, a pilot study, but it showed that having a school nurse help and facilitate the process for a child who needs glasses to get those glasses, and not just to get one pair, but actually have a pair that stayed in the school, and to do some additional education with those involved, that it really improved the number of students that continued to have glasses when they needed them. So educators like that, because of course if a student can't see, then they're unable to learn. Another area that focuses a lot with educators that we use is this study that was done in 2011 that looked at the amount of time principals, teachers, and secretaries were spending when there was not a school nurse in the school. And it found that it estimated that a principal spent about an hour a day doing things because the school nurse was there. Teachers and secretaries, it was less than that, but they were able to convert that information to dollar figures to show in education terms the role and the impact that school nurses could have. As Carol mentioned already, case management is a huge issue that we see that school nurses do a lot, and that's a big buzzword right now in, at least here in the United States, is care coordination and case management. So we see that as an opportunity too, because of the research that has been done, to be able to articulate that in a way to show that school nurses are a key part of that case management, especially once the student is out of the hospital. And then finally, the public health side of it, which we do see as part of school nursing. And there's been some good research that shows that having a flu vaccine clinic in the schools, that it actually helped. Over a few years, they did a retrospective study, showed that there was a decrease in or a difference in the absences in schools that had these flu vaccine clinics versus those that didn't. They're estimating probably because also the herd immunity that was there. So these are just a few of the studies. Again, we definitely use more. And at the bottom, it's a little dark, but there is a reference to, on our webpage, The Case of the School Nurse, which is a document done a year or 2 ago that outlines some additional research that and evidence out there regarding what school nurses do. We're always trying to collect more, though, because definitely this is what we need as we try and articulate. But I wanted to take a few minutes just to speak about this international research we're doing. So far we've had 276 participants from 17 countries. Some of those countries only had 1 or 2. The far majority of the participants, which were school nurses, were from Australia, Canada, and Hong Kong, China. Definitely one of the limits of the study was that it was in English. We've had offers of having it translated in some other languages that is being worked on now, because we definitely want to hear from all school nurses. It was just the limitations that we had here. But what has been interesting is we did some informal focus groups that helped with this too, is that there definitely are different models of how school nursing is done. As Carol mentioned, here in the United States, the focus has traditionally been on acute care, and then health promotion has increased as the years have gone on, and now we kind of see it as both acute care and the public health. In other countries, the focus has definitely remained more on the health promotion and prevention side, and more involvement of public health nurses. Oftentimes, though, that they might be contracted into the schools and might just do a specific thing, like a screening, like vision screening, for example. And those school nurses actually spoke about how they would love to be able to do more, and they could see the need, but they were contracted to only do one thing. So what I wanted to focus on was just kind of interesting, which I think sums things up well, is some of the commonalities from the research that was, I think, seems to be pervasive in all the countries that we spoke to, and supports what's been said today, that there's definitely a misunderstanding of the role of the school nurse across the board in a variety of countries. People remember what the school nurse did when they were a child, maybe, or they think of very traditional lice always comes up as a big part of it. And with healthcare constantly changing and increases in technology and social determinants of health, the role of the school nurse has definitely morphed a bit, although it's rooted in the same concepts of public health, and yet we have not necessarily articulated that well to people outside of school nursing, or sometimes even within school nursing. So that's definitely an area that we see where we can really try and impact. I know here at NASN they are working on a PR campaign to try and help with this so that we are all using the same words when we articulate what school nurses do. The other thing was that there was potential to do so much more. As I mentioned, the nurses that do screenings. On top of that, many school nurses mentioned how they would love to focus more. They could see bullying going on. They could see the mental health issues coming on stronger. So many potential things that they could do, but as it kind of comes to the third bullet, the constraints they had, partly maybe because of their contracted time in the schools, but also because oftentimes they're covering multiple schools, and the ratio of a school nurse to the student and what they were able to do was just a small amount of what they saw they could do and the great impact they could have, which goes back to also being able to collect the data to show the impact that school nurses have to have more school nurses in the school. So we kind of are going in a bit of a cycle there. But I found it interesting that these were definite commonalities that came across from all the different countries. And I see these as areas that, as well as with research, that working together, as Carol mentioned, and seeing how we can help each other and learn from each other to really strengthen the role of the school nurse across the nation, I think would be great. Just in closing, I found this quote that I thought kind of summed up what we're talking about. It's in the book, 5 People You Meet in Heaven. It says, "The world is full of stories, but the stories all are one." And so there are definitely differences between countries due to healthcare structure, culture, and so many other things. But I find it interesting, even with all the different stories, the different ways things are done, in reality they all come down to working with students and that everyone wants the best for students. And so I thought that was a good way to end. So I'm done.
Thank you, Erin.
Thank you.
Excellent presentation from yourself and from all 3 presenters. For those of us online, we're we'll be able to extend the session. It's only a question of whether everybody can stay for the whole session. So we'll go for the next 10 or 15 minutes at least to allow for questions and comments. So you can do that one of 2 ways, either typing a question into the chat box or a comment into the chat box and then pressing enter, and we will read those out as they come in. Or you can put up your hand, so I'll be able to call on you to speak. If you look under the word participants, you'll see a little hand there. If you click on that, it will alert me that you've got your hand up, and I'll ask you to click on your microphone. So either way, if you would want to ask a question or make a comment about what you've heard in the 3 presentations, please do so, and we'll start to open it up for discussion. One comment maybe that I could ask all 3 speakers to respond to is looking at how do we bump this up? As all the speakers have noted, much of the evidence and the experience in school nursing, as in school health promotion, is trapped in either specific health issues or at the school level. How do we bump it up into more of a systems kind of a view of it, and how do we move that agenda forward so that people are beginning to think about not so what happens in the individual school and the individual nurse is important, but how do we make this a health authority, local health district kind of a conversation, or a school board conversation with the health district, and how do we bump this up both into the policy making of ministries or into the professional decision making in terms of other professions? How do we generalize this issue? And so either of any of the 3 speakers, if you'd like to sort of think about that and comment as we await questions and comments from our participants.
Doug, I'll go ahead and start the conversation, and then the others can jump in. I think that's what's so critical about what we need to do for next steps. I can speak for the United States. Traditionally, school nursing has been funded and employed through education, and so in some ways they're kind of separated from the rest of the healthcare system. And that's not always the case, I should say, but that's just the majority. That's changing though, and I think that's an opportunity between that and healthcare reform that's going on, is the opportunity that school nurses have to step up and articulate how they do fit into the healthcare system from a systematic point of view, which I think we do specifically in regards to care coordination, access to care, and a multitude of other health promotion and prevention social determinants. With school nurses right there, they're the eyes and ears of public health in many ways, if they're employed in public health or not. But I don't know if we've always done a good job of articulating that. And what I mean by that also is providing the tools to local school nurses, because so many times healthcare decisions are made on a more local level, but then also making sure we have federal partners as well that can bring the message both from the top down and the bottom up until they meet. I think we make assumptions a lot of times, but it's been our experience, especially of late, that people just don't know what we do, and so until we tell them and show how it fits in, that's not going to change. So it's a great opportunity for us.
I had a thought, Doug, as well. In conversation with people recently, and after reading an amazing article about Towards a Healthy High Schools movement, it's apparent that really high school students are the future parents. And there's a great deal of evidence about the value, like the 0 to 6, focusing on early childhood and you know, putting resources in early. Well, this is like really resourcing students, especially high school students, before they're launched off into the world, would be a very wise investment for both health and education, because they will be the parents of the next generation, and they will be the people who are either going to have chronic diseases or not going to have chronic diseases, depending on how they are you know, able to move through life in various health aspects. So I think if we think of it as an investment in the next generation even, let alone those students themselves, it might be a help.
Great, thanks, Carol. Yvette?
Well, I think we need to get the right people in the same room, a little bit like we did with trying to have the education system adopt the healthy schools approach. For a long time, probably for the first 15 years or so, it really was a health sector, public health sector driven movement. And you know, it was only at the beginning of the 2000s that we actually saw the education sector coming on board. And even at that point, governments were focusing on 0 to 6. It's interesting to note that in the United Kingdom, they have revised their approach and are now looking at you know, the early years to early adulthood, and are combining their programs so that nurses are working across that age group. And there's also evidence saying that, you know, if you undo everything that you've done 0 to 6, if you don't invest in the school years that take us right into early adulthood. So I think we need to get the practitioners, the parents, the students, the educators in the same room with the policy people, much like we did with Healthy Schools, to share the evidence, to share you know, evidence-based approaches to actually getting the work done. I think we need definitely a major study in school nursing. It could be an international study. It might even be funded by an international body. I think there are some possibilities there. I see in the chat room that Jennifer R., she actually did a master's practicum evaluating the public health nursing role in schools in North Shore of British Columbia, and certainly Dr. Elizabeth Sirik is one of the chairs, the public health chairs, I believe. It would have been wonderful. It would be wonderful to engage someone like her in maybe a national study of public health nurses in schools. And I would invite Erin, if she can talk, to join the conversation or comment on that.
Just to jump in, and thank you, Jennifer, and the others who have responded. One of the things that we do after these sessions is the session is recorded, and the recording is available, and you can move forward or backward in it to come back to this. But we'll also post the slide presentations, and we're also committed to putting together a page of the various references and reports that are showing up in the Exchange, the chat box right now. And so that will be posted and all linked off of either the webinar page on the International School Health, the website Schools for All, or in a listing, a combination of linkages to that. So please be sure that you'll have easy access to the, and if you have anything to share, if it's been published, just send me the link. If it's available, please send me a copy and I'll make sure it's posted and available to you. So we will follow up with this, and we will be following up with a bit of a discussion, online discussion about some definitions. So looking at defining the practice of public health nursing or school nursing, kind of looking for a worldwide descriptor. And we will be doing a two-pager looking at trying to pull the evidence together for decision makers to look at in kind of a briefing note format. So that will be helpful. But I did want to go back to the, so following up on that, go back to the opportunity that's before us, and Erin and Yvette and Carol and others, we've been trading various reports. I think the timing is very good. There's been interest in school nursing around the world, and I think it's also tied to another conversation that's going on, which is being led by educators. Educators are now asking the health system to think more carefully about how they work with educators and what investments they're going to make as a kind of a quid pro quo, as kind of a bargain. And Erin and Yvette were presenters at a symposium we did with a lot of American school health leaders and some Canadian leaders who looked at that topic, and actually the nursing associations in both countries did a joint news release, which we'll bring to your attention through links, looking at why the health system needs to make a greater investment as a way of persuading educators to become more sustained in their involvement. And so that's a real opportunity. And if you look at what's happening in Europe, there's a recent report addressing that issue of health and education working together. There's a very high-powered group in the U.S. And lots of conversations among the traditional leaders in the U.S. about new partnerships between education and health. There's some really good work done by the Joint Consortium for School Health, the paper that commissioned by them, as well as two excellent background papers, one produced in Quebec and a couple of others that again are looking at how health systems can really work better and more effectively within education systems. And in my view at least, I think it's a real opportunity for people to say, well, the real backbone to that investment, to that kind of sustained involvement in school health promotion is school nursing. And so it will need to take different shapes and different sizes and different forms, but I think the timing is very good. And maybe as closing off the session, I'd ask the three speakers to look at that, and the timing of it, and what immediate steps they think would be the best to take from here on in. So in order of presentation, Yvette, and then Carol, and then Erin, and then we'll finish up. Any further comments from our three presenters?
I just appreciated the comments that are being shared right now in the chat section, and it seems to be a willingness to share what we're learning about nurses in schools, and people I think are looking at you know, trying to respond to this, to the needs in the schools. It's certainly, schools are not the same place where I was a public health nurse, you know, 30 years ago. And so I've just appreciated everyone's participation and attendance at this webinar. And I still have the passion, so I still think I'm going to be hanging around here to see if we can maybe just bump it up, as you say, Doug.
Carol?
Hi, I just would say I saw the comment down in the chat about involving other professionals and teachers, you know, other roles to support and reinforce public health nurses' activity. Because of the shortage of nurses, because that's the other thing. Even if we had our dream, you know, magic wand waved and we could have nurses assigned to all schools, would we have all the nurses? So really, I think there is a huge role for nurses as well in building the capacity of schools, teachers, students to be able to take charge of health to a great extent on their own terms, you know, within a structure of a planning committee and, you know, contributing in that way. So it definitely doesn't want to sound that we should, you know, be doing all the work. I think there's a huge facilitation role as well and capacity building role that we would like to see nurses undertake.
Great. And Erin?
Yes, I agree with what's been said so far, and the only thing I can really add or maybe just emphasize as well is I think the biggest thing is not to lose the momentum we've started. And I love the idea, I love the sharing, and Doug, you've been great in helping us put all this together, but finding other avenues that we can really network different levels of school nursing, from practice to research to whatever, and working together to just strengthen the literature and the evidence that's out there. And then with that, just as a plug, I also know of a lot of really good things that go on that don't get published. And I know it's busy, and it's sometimes people think, oh, I finished it, check, move on. But I think that's going to be another thing that's really critical, is to make sure that we do publish and get the word out, let people know so that we can all use it and share with decision makers what is out there, and then build off that so that we continually forward and strengthen the research that's out there related to school nursing. I also love the idea of doing some type of an international project and looking at an international sponsor. I think that would bring a different perspective, both from health as well as also from education and others too. I think the opportunities right now are great, and just making sure we stay on the momentum. And I guess I should say, and I'm committed to do that because this is very important to me as well.
Excellent. Thank you, Erin, and thank you. I'm going to ask everyone to join me in thanking our speakers. If you look at, this will be a little nonverbal communication, but if you look at the little logos under the word participants, you'll see a little happy face, and if you do that drop-down menu, you'll find there's a little applause button. If you would join me in thanking our speakers by clicking on your applause button, if you can find that. And on your behalf, I will thank our three speakers for an excellent start to this conversation. I'd like to remind folks that there's another webinar on Thursday morning or Thursday afternoon, depending upon which part of the world, in which we're going to be hearing from the lead authors to a Cochrane review on comprehensive school health. So that's going to be an excellent session. And we will follow up this session both online in terms of creating the links to the various materials, as well as asking you to comment on some brief web summaries so that we can continue this conversation. There is also, I'll find out the details and post them, or maybe our speakers can take a lead on that. There is an International School Health Nurses Conference in July in England, which folks may be interested in, maybe combining a bit of travel and holiday and work, and we'll post those dates as well. We do keep a page on school nursing on our Wikipedia-style webpage, which we'll follow up with, and we do have a Twitter account where we clip items of interest on school nursing. So again, I'll make sure those links are made available too. But again, to thank our speakers, if you haven't already done so, push your applause little button there. And Aaron and Yvette and Carol, thank you once again for an excellent start to this process. Thank you. If